Hello everyone, welcome to Nursing Insights. Here I will discuss about CLABSI. So CLABSI is central line associated bloodstream infection. So it's a common infection in the every hospital of the patients who are having the central line. We all know that in the hospitals they are using venous access via catheters like central line, IV line. These are helps to provide medicine, fluid, blood or the nutrition and also helps for hemodynamic monitoring. So CLABSI is a serious infection that occurs when microbes enter into the bloodstream through a central line. So here is the definition of CLABSI. CLABSI refers to the bloodstream infection that appears in the presence of central venous catheter or central line or within 48 hours of removal of a central line. Then the causes. So previously we discussed that CLABSI is the infection when the microbes enter into the bloodstream through central line. So here presenting the microbes like Klebsiella species, Pseudomonas species, Protea species and Enterococcus faecium. So these are the gram-negative bacteria. Within these, the Klebsiella species are more entering into the bloodstream through the central line. Then the risk factors. So previously we discussed which are the microbes entering into the bloodstream through the central line. So here in which purpose or which conditions there have more risk or chances of infections like patient, operator and the catheter related factors. So patient factors. Age. If the patient having the age more than 60 years or above and increasing severity of illness, granulocytopenia. So granulocytopenia is decreased level of granulocytes like neutrophil, basophil, eosinophil and the presence of distant infections and others factors like malnutrition, decreased level of immunity power, etc. Then catheter factors. So within the catheter factors, if the catheter is coated by antibiotic or antimicrobial coating and the insertion site. So there have three types of insertion site like groin insertion, neck insertion and the chest or upper extremity insertion. For the groin insertion, the catheter is inserted through the femoral vein and there have more chances of infection. Then neck insertion. So in the neck insertion, the catheter is inserted through the internal jugular vein and they are having the intermediate chances of infection. Then the chest insertion. So in the chest insertion, the catheter is inserted into the subclavian vein and they are having the lowest chances of infection and in the chest area insertion, it helps to diagnose the variety of the heart problems. Then multiple lumen catheter. So if they are using the double or triple lumen catheter, it also increases the chances of infection. Then symptoms. So due to the severity of the infections, what are the symptoms may occur? So fever. Here the temperature will be more than 100.4 degree Fahrenheit. After that chills, confusion, rigor, feeling dizziness, redness, pain and swelling. So if the infection is more or sepsis may occur, it will cause the complications like shock. So here shock means a septic shock due to the severity of infection and the sepsis. It may decrease or collapse of the blood pressure due to the infection. Then BSI. So BSI is bloodstream infection. So bloodstream infection, it occur due to the entering of bacteria like Streptococcus aureus, Streptococcus pneumoniae, E. coli, virus like HIV, fungi like Candida and mucous species. So it have two types, intravascular and extravascular. So later another slide we will discuss BSI. Then multiple organ failure. So multiple organ failure, it also occur due to the severity of the infection. So last one is the prevention. So how we can prevent the central line associated bloodstream infection. So first and foremost step is the proper hand hygiene by using the hand washing procedure and using the gloves, sanitizer, etc. Then use chlorhexidine solution for the skin preparation and follow non-touch technique while handling the line. So we should not touch by our bare hands in the central line area or surrounded the area. We use hand gloves or hand rough for during cleaning the central line surrounded area or during dressing. Then change gauze dressing at least every 2 days or if semi-permeable dressing means at least every 7 days. Then avoid using femoral venous area for catheter insertion because if the groin area or femoral venous catheter insertion area, it may have the more chances for spreading the infection. Then remove unnecessary catheter. So here is CLABSI bundle, which is maintained in every hospital to prevent the CLABSI infection. So here have some criteria which is maintained in every hospital in the every shift. So here first and foremost step is perform hand hygiene before insertion and during care. So it is a most important step or most important criteria. We all know that there have been 5 moments for doing the hand washing or perform the hand hygiene. So it's important. Then use maximum sterile barrier precautions. It helps to protect both operator or the staff and also the patient from infection transmission, and for that they are using the PPE, personal protective equipment. It must be sterile for insertion of the central line and also the guide wire exchange and also during the dressing, and also they are using the needle-less syringe for preventing from needle stick injury. Then perform skin antisepsis with chlorhexidine and alcohol 70% solution in circular motion. So here not using the bare hands during the dressing or during giving care the central line. So here using the antiseptic solution, chlorhexidine solution or alcohol 70% during dressing or giving the care of the central line. Then use transparent semi-permeable membrane or tegaderm dressings. So here it helps to reduce the surgical site infection rate and also reduce the burdens like additional hospital stay, additional cost for the further infections. So next one is daily site inspection and flush with 0.9% saline or heparin at least once in each shift. So why heparin is important to give flush? Because it helps to prevent the occlusions or blood clot. So while giving the heparin during flushing, so it should be flushed slowly, and after that the flush with 0.9% saline, it is more useful to clear the catheter of the blood or the fibrin which already built up in the central line. So it is helpful to clear the line. Then half or port cleaning immediately prior to each use with chlorhexidine or 70% alcohol. So port cleaning is also important. Same here, to clean the accumulation of the waste or pollutants in the port to prevent from obstructions, and it helps to give easily any medications or nutritions etc. So change dressings every 7 days unless the dressing is salt or loose. Then central line replacement as per clinical indication. If there are any obstructions or medications not going properly, that time as per doctor advice we or the staff they change the central line. Then documentation. So last one, the documentation is important because if it will done in the first shift, the second shift members know that in the first shift they already done this. So every hospital it's helpful to maintain or also is used for prevention of the central line associated bloodstream infections. If you have any doubts or question, please ask me through comments.